In this video, I am going to explain the role of the right QL in holding the pelvis into tilted positions, lateral pelvic tilt and anterior pelvic tilt. And remember, lateral pelvic tilt and anterior pelvic tilt are just visible representations of this left AIC, right BC pattern that we talk about in postural restoration all the time. But I'm also going to point out that you can't address the right QL only by itself, because the right QL always acts with other muscles to hold you in this position. Trying to simply release the right QL will not do anything in the long run because you haven't addressed its primary functions, which are rotation of the pelvis to the right and its role in breathing. Towards the end of the video, I will describe this technique that seeks to inhibit not only the right QL, but also the left psoas. But before I describe what this technique is doing and kind of explain it a bit further to give you an idea of what's going on, you have to understand how the left psoas and the right QL are working together to keep the pelvis and ribcage in this left AIC, right BC pattern that also people misidentify as a lateral pelvic tilt. In reality, again, it's just a visible representation of this left AIC, right BC pattern. So let's look at what the right QL and the left psoas do and how they work together to keep us trapped into this left AIC position. As you can see from the diagram, both muscles, the right QL and the left psoas, both muscles attach to the lumbar spine. The right QL, importantly, also attaches to the bottommost rib on the rib cage on the right side. The psoas does not attach to the ribs, but that's an important point. The right QL attaches from the top of the pelvis on the right to the bottom rib. So it holds that area together. So when it's tight and overly active because you're in this position for too long, it will pull the ilium up and the rib cage down, and everything gets scrunched together on that right side. So that is why it's always so tight. The left psoas, on the other hand, attaches to the lumbar spine on the left, but then it attaches to the left leg. And so it pulls both of those. When you just look at their influence on the lumbar spine, this is important. The influence on the lumbar spine of the right QL and the left psoas have a combined effect of turning the lumbar spine to the right, along with the pelvis. So if the lumbar spine goes to the right, the pelvis goes with it, and that's what establishes the left AIC pattern. Now, the biggest influence is from what's right above the right QL, which is the right diaphragm. So add that muscle into it. You have a right diaphragm, a right QL, and a left psoas that are all, remember, the right diaphragm is bigger than the left. So that's why the pull to the right side is greater than the pull to the left side. So the right diaphragm, right QL, and left psoas, the influence, which all attach to the lumbar spine, and obviously the right QL and the right diaphragm attached to the ribs, the pull on that lumbar spine and rib cage to the right is greater than to the left. And the left psoas, the job of the left psoas is to also assist in lumbar rotation to the opposite side. So the left psoas rotates the lumbar spine to the right, along with the right QL and the right diaphragm. Now, when your pelvis is over to the right in that position, the left psoas is in a constant state of activity not because it wants to be, but because the pelvis is positioned in that direction. So if it's positioned there, the left psoas never gets a chance to shut off. Now, the other issue is this left leg, if the pelvis turns to the right, this is my right, into the left AIC pattern, in order to walk straight, we have to externally rotate our left leg to keep it straight so that we can walk straight on a pelvis that's still turned to the right. And that's the problem. That's the compensation. You'll see at the bottom of the diagram, it says left leg external rotation. So that left psoas, at the same time it's turning the lumbar spine and the pelvis to the right, is turning the left leg out to the left. And again, it stays, and that's compensation so that you can stay straight as you walk. That positions the left psoas in such a way that it can never turn off. So the left psoas does not cause this pattern. The left psoas cannot be released on itself, by itself, because the right side of the body is doing something at the same time. No muscle works in isolation. They work in tandem. They work as a team. And in this particular team, these muscles, the right QL and the left psoas, are conspiring to keep everything rotated to the right. And then the left leg turns out, which creates even more tension because you have to keep your left leg turned out all the time, which further destabilizes the left side of your body. So in order to change this situation, there's one more thing I talk about. If you notice, the right QL attaches to the ribcage, and this is where the breathing becomes part of it. You cannot inhibit or turn off or relax a right QL if you don't take into account breathing, how you are breathing. In this left AIC, right BC pattern, we are breathing over on the right side. The right QL has a function of bringing the bottom right rib down during exhalation. When we're over on the right leg, the right ribs are stuck in a state of exhalation. The left ribs are stuck of inhalation. So that's why you see that left rib flare so often. The right ribs are stuck in a state of what we call exhalation. The left ribs are in a state of inhalation. So internal rotation rib internal rotation on the right is an exhaled state. Rib external rotation on the left is an inhaled state. And that's how you're living. So if you're living in an exhaled state and the right QL fixes and brings down the bottom rib during forced exhalation, then that right QL is always overactive as an exhaler. The left side, the left QL, doesn't have that chance to work as an exhaler because you're never exhaling the left ribs. They're stuck up. They got to come down so your body can shift to the left. Only when you can use the left side of your left abdominals and then the muscles that support the left side of the pelvis, like the left hamstring and the left adductor, those muscles will then turn your pelvis to the left and bring your left ribs down into an exhaled state so that you can then open up the right side into an inhaled state. And that right QL, which is functioning as an exhaler and keeping you over on your right side, will then get to let go as you inhale into the right side of your body. So let's examine what this technique is doing. And I'm going to kind of explain it in some detail just so you realize there's a lot going on here beyond just trying to do an exercise. PRI techniques and this technique are ways to experience your body differently so that your brain can experience pressure from the ground and in this position from your hands in different ways, in ways that it's lost. So in the position, you're going to stand facing a desk or countertop. Now, it has to be against something so that when you push with your hands, the table doesn't move. In that position, your back is not extended. Your back is rounded. So you have to have your legs in a position, or your feet in a position that you should walk yourself back. All right, so you put your arms on a table and then walk your feet back a little bit until your back is essentially parallel with the floor. It cannot be an arched back. If it's an arched back, extended back, nothing will work. So your back is going to stay rounded. When it stays rounded or in a neutral position, you then have the ability to expand it with air and inhibit or turn off the muscles that we're trying to turn off. Again, if your spine stays extended, if it's too arched, you will not turn off the QL and you will not turn off the hip flexor because those muscles will be on if you're in extension. In this position also, your lats are inhibited. This is a lat inhibition technique because your spine is rounded and your arms are up and above your head, almost above your head, into shoulder flexion. In that position, that's a great way to lengthen and inhibit the lats at the same time. So this is a lat inhibition technique. In instruction number 2, it says place both hands on the surface in front of you and move your feet away from the surface so that your back becomes parallel to the ground. You want to feel your hands pushing into that counter or the table, whatever you have your hands against. When you shift your left hip back in number 3, that will automatically increase, or should automatically increase, the pressure of the right hand more than the left hand. So you are making that link between the right arm and the left leg that has to occur, or your right arm and the ground underneath your left foot that has to occur. That's one of the first things that we have to do in PRI is get your brain recognizing the link, the connection between the right side, the right arm, the right scapula, shoulder blade, and the left leg, left hip, and the ground underneath that left foot. That's how your brain knows you're on the left leg. That right arm comes forward and rotates your body to the left. So that's the connection you're making at that point. As you shift your left hip back, as that left hip shifts backwards, you're shifting into what we call the right AIC pattern, which is desirable. It means you're on your left leg. So your pelvis is stuck in this position. So what you're doing is turning it into this position. So it rotates your pelvis and lumbar spine to the left. It should stretch your posterior hip capsule on the left side, which is very often tight on a lot of people. Continuing with instruction number 3, keeping your left hip back and weight through your left midfoot heel. You have to sense your left heel. That's important. Heels equal hamstrings. If your weight is on the front of your left foot, like towards your toes, you'll keep your hip flexors on. You'll keep that psoas on. So it has to be back through the left heel. Lift your right knee up and turn your right lower leg in. As you lift your right leg up and turn the leg in, turn the foot in, the right leg is actually externally rotating. The left leg is now in a state of internal rotation. So before, I told you in the left AIC pattern, the pelvis to the right and the left leg has to externally rotate and abduct to stay straight. We're flipping that. The left leg is now adducting and internally rotating, so that creates compression through the left side, so the left psoas is automatically inhibited because now you have a left hamstring and a left glute medius and a left adductor. On the right side, the right leg will come forward into flexion and externally rotate. And that is now in that position, you're now using the right psoas. You're using the right psoas to help rotate the pelvis to the left and the lumbar spine to the left. And you're maintaining that position. So we're using the right hip flexors appropriately, finally. So we're not using the right hip flexors to stabilize the right side of your body when you're over on the right side continuously, and I've made videos about that. You're actually using the right hip flexors appropriately by bringing the right leg through, which also rotates the spine to the left. It's important when you pick up the right leg that you don't let your body sag down. You shouldn't let your body drop. You have to stay in that parallel position. Now, as you start to breathe in through your nose and out through your mouth, when you take that breath in, make sure you push with your hands and your left foot. Now your brain is sensing push from the table and the ground underneath you. Remember, your brain can only respond to pressure, internal pressures and external pressures. That's really how it knows where it is in the walking cycle. So we react to pressure. That pressure will help create compression through joints that have become destabilized. And when you can pressurize those joints, particularly the right shoulder in this position and the left hip, you can now expand your rib cage with air. So this is a good position to expand the right side, because if you shift into your left hip, the left side closes and the right side opens up. But also because your back is parallel to the floor and in a slightly rounded position, now you can expand the posterior portion of the rib cage also. That gets tight when you're in a state of extension. Between each exhalation and inhalation, so you breathe out, get all the air out, and you should feel left abdominal activity. If you feel your right abs, it means you got to push more with your right hand. You should feel your left abs more than the right, or you shouldn't really feel the right at all. But at the end of each exhalation, pause for 5 seconds. So you exhale, pause, 5, 4, 3, 2, 1. As you're pausing, don't keep the push, and then inhale again. Okay, so you're slowing everything down, you're slowing all your breathing down, you're maintaining the push, and then you should have a successful technique. Now, this technique is not for everybody. Who would I actually use this with? Remember, this is one technique that's part of an overall program for people who cannot turn off their right QL. So I would not use this technique until I knew I had someone into a plain old left AIC, right BC pattern, or I have them neutral. If they are a PEC, patho-PEC, meaning their pelvis is forward on both sides and the rib cage is extended on both sides, or is flipped up and their spine is extended and they've got a forward head posture, I would not use this technique because they're not in the right position to make use of this technique. And that's what you got to understand. If you've never watched any of these videos, if you haven't watched my channel, techniques have a context to them. they have to be used appropriately. If you choose the wrong technique for somebody who's not prepared for it, they're just going to hurt. It's not going to feel good, or it's just not going to do anything because they're not in the proper position to make use of the technique. Someone who is what we call PEC, and if you don't know what that is, you'll have to watch the video about it. If you don't know, if they're in that PEC position, this would not really be, I would not do this technique with them. I would get them neutral first, because again, they may not even need this once they're neutral. So everything has perspective. That's why I just don't put up tons of techniques, because it makes no sense to you. Just doing that's no different than all the videos on YouTube that say do this one stretch or this one exercise and everything's going to be better. And it's baloney. That's not how it works. So, but since this is on the PRI website, and if you want, there's a couple others on there. If you go to the Postural Restoration Institute website, this was part of a series on breathing that the founder did back in May of 2020. So if you go to the PRI website and click on community, and then you go to May 2020, you'll find 3 or 4 of these types of techniques. And since they're on there, I feel free to share it like it is, like it's shown here. But remember, it may not work for you. You might not be right for that technique, or that technique might not be right for you as you exist at that point in time. Maybe it will be good for you at some point, but maybe not now. So it's something that people can try because it's already up on the website, and hopefully this has given you some insight on how this whole process works and how a right QL can be inhibited while using the left side of your body.